The maker of Camels and Winstons hoped the company could reverse its declining fortunes with a revolutionary new reduced hazard product that barely used tobacco at all.
One experiment that was done early on was just to determine how we could deliver smoke that was completely non-toxic. So we devised some cigarettes that were made of glass for demonstration purposes. They had glycerin coated on the inside of the glass. Glycerin is simply a compound that will evaporate or vaporize when heated and then condense very readily to form a smoke, to form particles suspended in a gas. So then the challenge was to take that basic system and then make that acceptable to smokers by developing some type of tobacco flavor, tobacco taste, and as well as provide some nicotine to the smoker.
The new product, called Premier, would use a unique technology to deliver the nicotine. But it was designed to look like a traditional cigarette.
Premier was an interesting device. It looks like a cigarette, but the ends you see this white ring that's fiberglass, and the black dot is a fuel element. And if I take out the fuel element with these tweezers, it's attached to this aluminum cylinder. The aluminum cylinder, in turn, contains little beads of alumina that have nicotine and glycerin on them. And these beads are heated by the fuel element when it's lit, and nicotine and glycerin vaporizes off of these beads and then is condensed into an aerosol that can deliver nicotine deep into the lungs.
Because the development of Premier was so different, we did have to develop new flavor systems. We worked with all the major flavor houses in the world. It turns out that was an exceedingly difficult project to design those types of flavor systems.
One problem was that until the flavor capsule heated up, the only taste was sulfur from the match and burning charcoal. The effort to fix Premier's taste was documented in a best-selling book and television movie.
Now, 8% of that group sampled at least one Premier to give us their opinion of the product.
Bottom line?
Well, of all the groups we tested, the response to Premier was just about uniform.
Mm-hmm. They all said they tasted like
was the consensus, yes, sir.
Premier was introduced in the autumn of 1988 and came with instructions to use a butane lighter. The effort had been the most ambitious yet to create a reduced-risk product. Reynolds expected applause, but that's not what happened.
The American Medical Association says these are not cigarettes, but a sophisticated drug delivery system which gives smokers strong hits of nicotine, a drug the AMA says is so addictive it wants smokeless cigarettes banned.
Consumers were equally unenthusiastic with what was dubbed a smokeless cigarette.
Nothing. Zero. It's like smoking blackboard chalk.
Another first for American technology. No wonder the Japanese are trembling.
R.J. Reynolds has announced it's bailing out of its smokeless cigarette project, but then those smokers who tried Premier apparently didn't like it anyway.
After only a few months, Reynolds withdrew Premier. But the story wasn't over.
In the meanwhile, what had emerged was the secondhand smoke issue. There was, across the country, a wave of local ordinances. You can't smoke in public buildings, you can't smoke in public places, you can't smoke here and there. And they were sitting there with this product. It occurred to them that if this product didn't produce a lot of smoke as well, you would solve this other problem.
It took 6 years and a total cost of nearly $1 billion. But Premier was reborn as Eclipse. The new design did away with the aluminum flavor capsule. Instead, the burning charcoal tip would heat a column of sheet tobacco laced with glycerin. Eclipse was presented as a smoking alternative that may present less risk for certain diseases, including cancer. The public health community was cautious.
Does this technology have the potential to reduce toxicity? The answer is yes, it has the potential. Does this particular product reduce the toxicity? The answer is, I don't know, because the only information I have is information that is bought and paid for by R.J. Reynolds.
An independent study commissioned by the Massachusetts Department of Public Health showed that when Eclipse was compared to two ultra-low tar cigarettes, Eclipse had higher yields of several toxins, especially when the charcoal tip burned hot from heavy smoking. Reynolds' saga was closely followed by the competition. In the late 1980s, Philip Morris revived its efforts to electrically control the burn of a cigarette. 50 staffers were moved to an industrial park and given the charge to bring a product to market.
We decided that what we should do is replace the burning end of a cigarette with a battery, a heater, and electronics. What I have here is the first attempt. The consumer draws on the cigarette just as you would a normal cigarette. My mission was to make a design that really worked and it could be consumer friendly and just take it to the step where we can commercialize that concept.
The heater's electronics would have the power of an Apple II computer, capable of sensing a puff and instantly heating a metal blade to a precise temperature for a specified duration, producing little secondhand smoke or ashes. A cigarette of unique design was required for the heater. Beneath the paper, a heavy cylinder of sheet tobacco would be singed by the heater blades.
Keep track of their battery status and their cigarette status.
The device would dramatically change the smoking ritual, so various types were auditioned. In the end, the size of the batteries and electronics precluded many of the designs.
You'd be able to put this into your pocket. This one is our current product that we are selling in the Richmond market, and Osaka, Japan. Gives you your battery capacity. It provides you a cigarette icon that monitors your cigarette and fits pretty nicely in your palm. We would ideally like to reduce this and make it a smaller product. The smoker would insert their cigarette, fully depress it, and the lighter actually senses that we have a cigarette and turns on. So now the consumer is ready to smoke. The consumer places the cigarette on their lips, draws on it, and voila, smoke is produced.
The new smoking system, called Accord, is now available in test markets. And although sales have been modest, Philip Morris continues its development.
I don't think Accord is a finished product. I think Accord is a marker for the public and for the regulators and for Congress to see that Philip Morris is in the game too. And Accord is simply too awkward and too improbable, in my mind, to take off as a credible product.
Determining whether Accord or any of the other new products actually are safer is a highly complex process. The Institute of Medicine recently spent a year studying just how such determinations might be made. In its report, the Institute proposed that to assess comparative risk, these products be tested by an independent agency, much as any new drug would be, on cells, on animals, and humans, a process requiring at least 2